Haji Karimlu B has looked at hyperbaric oxygen therapy as an adjunct for intracranial radiation necrosis. So what is all this? Basically, people who had tumors or arteriovenous malformations in the brain, as a part of their treatment, they're going to get radiation therapy to that site. And as a result of the radiation therapy, they can have radiation necrosis, where the radiation goes on damaging that part of the brain. And it keeps on doing it until it stops. But the end result is a vaso-occlusive and obliterative enteritis that leads to damage in the adjunct normal functioning parts of the brain. So that being said, what do we normally do? We normally do steroids and all kinds of other stuff to get that controlled, but steroids have problems. And there's weight gain, there's mood issues, there's diabetes, etc., right? So their question is, can you do hyperbaric oxygen therapy? And they've reviewed their patients over so many years to see. It's published, so obviously there's a value in hyperbaric oxygen therapy. But again, it's supportive that there is such a thing, and it's useful to these people. Our own experience has been the same for the past decade. You can get people off steroids, you can get their brain lesions to heal, and in some cases where they don't feel better, don't feel any different, in the least, the imaging shows that they're not actively inflamed. So if they don't feel better but their imaging is better, what is the benefit of that? It means that probably they've already had damage in those areas that's not going to get better, but it's not going to get worse.